As parents, we develop an incredible bond with our babies. We learn their cries, their smiles, their every little quirk. This deep connection gives us a special sixth sense when it comes to their well-being. We can often sense when something is off, even before any obvious signs appear. This sixth sense is invaluable, especially during a baby's first year of life. Babies are incredibly vulnerable at this age, and their immune systems are still developing. This means they can get sick quickly, and early detection of illness is crucial. By learning to recognize the subtle cues and signals our babies give us, we can ensure they receive timely medical attention and get on the road to recovery faster. Remember, you know your baby best, and your intuition is a powerful tool. Babies communicate with us through a language all their own, a language of coos, gurgles, cries, and body language. Learning to decipher this language is a key part of parenthood. It allows us to understand their needs and respond appropriately, especially when they're feeling unwell. When babies are sick, their usual cues and behaviors might change. They might become quieter than usual, sleep more or less, or refuse to feed. Paying close attention to these subtle shifts in their behavior can alert us to potential problems. It's important to remember that every baby is unique. What's considered normal for one baby might be different for another. Understanding your baby's individual baseline behavior is key to recognizing when something is amiss. All babies get fussy. It's a normal part of their development. However, as parents, we need to learn to distinguish between typical fussiness and behavior that could signal an underlying illness. This can be tricky, especially for first-time parents. One way to differentiate is to consider the intensity and duration of the fussiness. Is your baby fussier than usual, or for a more extended period? Are they inconsolable, even with your best soothing techniques? If so, it might be a sign that something is wrong. Another thing to consider is if the fussiness is accompanied by other changes in your baby's behavior. For example, are they feeding poorly, sleeping more than usual, or showing signs of discomfort? If you notice any of these red flags, it's essential to seek medical advice. Changes in your baby's behavior can be one of the first signs that they're not feeling well. These changes can be subtle, so it's important to pay close attention and trust your instincts. If something feels off, it probably is. One of the most common behavioral changes to watch out for is increased lethargy. If your baby seems unusually sleepy, difficult to wake, or unresponsive, it could be a sign of illness. Other red flags include excessive crying, irritability, and a lack of interest in playing or interacting. Changes in feeding habits can also indicate a problem. If your baby is refusing to feed, feeding less than usual, or spitting up more than usual, it's crucial to seek medical advice. These could be signs of a range of illnesses, from a simple cold to something more serious. Section 5. Tiny bodies. Telling symptoms. In addition to behavioral changes, there are several physical symptoms that can indicate your baby is unwell. These symptoms are often easier to spot than behavioral changes, but they can still be subtle, especially in the early stages of an illness. One of the most common physical symptoms of illness in babies is fever. While a slight elevation in temperature is normal, a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, especially in infants under 3 months old, warrants immediate medical attention. Other physical signs to watch out for include changes in breathing, such as rapid breathing, wheezing, or grunting. Changes in skin color, such as paleness, blueness, or a rash can also be signs of illness. Similarly, changes in bowel movements, such as diarrhea, constipation, or blood in the stool, should be reported to your doctor. Section 6. Fever friend or foe. Fever is a natural response to infection and is a sign that the body is fighting off illness. While a mild fever in babies older than 3 months is usually not a cause for concern, it's essential to monitor their temperature closely and seek medical advice if you're worried. For babies under 3 months of age, any fever should be treated as a medical emergency. This is because their immune systems are still developing, and they're more susceptible to serious infections. In older babies, a fever accompanied by other symptoms, such as lethargy, difficulty breathing, or a rash, should also be checked by a doctor. While fever itself might not always be dangerous, it's crucial to treat the underlying cause of the fever. Your doctor can help determine the cause of the fever and recommend appropriate treatment, such as medication or other supportive measures. Section 7. When to worry, urgent warning signs. While most childhood illnesses are mild and resolve on their own with proper care, some symptoms warrant immediate medical attention. Recognizing these urgent warning signs can be life-saving. One of the most concerning signs is difficulty breathing. If your baby is struggling to breathe, breathing rapidly, or making unusual noises while breathing, call 911 immediately. Other urgent warning signs include a stiff neck, a high-pitched cry, seizures, and unresponsiveness. Changes in skin color, such as a bluish tinge around the lips or fingertips, can indicate a lack of oxygen and require urgent medical attention. Similarly, a bulging soft spot on the baby's head, forceful vomiting, and refusing to feed can also indicate a serious medical condition. Remember, it's always better to err on the side of caution. If you notice any of these warning signs, don't hesitate to seek immediate medical help. Section 8. Trust your gut. Call the doctor. As parents, we have an innate ability to sense when something is wrong with our children. This gut feeling is a powerful tool that should never be ignored. If you're concerned about your baby's health, trust your instincts and contact your doctor. It's better to be safe than sorry. Even if it turns out to be nothing serious, a doctor's visit can provide peace of mind and reassurance. Your doctor can assess your baby's symptoms, determine the cause of their illness, and recommend the best course of action. Remember, you are your baby's advocate. Don't be afraid to ask questions, express your concerns, and seek a second opinion if needed. Your proactive approach to your baby's health can make all the difference. Section 9. Every parent's best tool, observation. Recognizing the early signs of illness in babies is a crucial part of parenthood. While it can be challenging at times, especially for first-time parents, becoming attuned to your baby's cues and behaviors is essential. The best tool any parent has is observation. By paying close attention to your baby's normal behavior, you'll be better equipped to notice subtle changes that could indicate illness. Trust your instincts and don't hesitate to seek medical advice if you have any concerns. Remember, early detection is key to ensuring your baby receives timely medical attention and gets on the road to recovery faster. By being vigilant and proactive, you're giving your baby the best possible start in life.